Thank you very much, Veikko, for your presentation. And I'd now like to ask you a couple of questions. What should people with diabetes bring with them on a flight?
Yeah, Karen, this is a very good question. This is a critical question for type 1 diabetics who are traveling to be prepared, for various types of things. And one is to prepare to prevent or treat hypoglycemia, too low blood glucose. And for example, what I usually carry with me is glucose. It can be either liquid glucose or then various types of glucose tablets. Insulins are the other thing. Both short-acting insulin and basal insulin, to have those at hand in the plane. Then, in order to be aware of what the glucose level at any time is, to have a glucometer on the package in the plane is good as well. And then there can be occasions, when it is good to inform others, that you have a diabetes. And for that purpose, I'm carrying, with a small card which explains in different languages that I have diabetes. If there's a partner traveling with, then the partner can also carry glucagon and give glucagon in case of hypoglycemia. So a few things, kind of standard setting when a diabetic patient goes to long-haul travels, can be packed in a small size and carried with.
How about going through security? Is there a special procedure?
There are no special procedures for security. I mean, you include into the packages what you usually carry. Occasionally, it has happened, that they notice, for example, I'm carrying insulin pen, and when people find this in my pocket or in my carry-on luggage, they may ask questions. But then if I tell them that I have diabetes, I usually get a very friendly kind of response to that, and okay, everything is okay. You have diabetes. So people in security have good info. I mean, they are well informed about diabetic travelers because there are so many, and they have a knowledge on that. Only once it has happened. I was traveling in one country where the security people were very strict. They knew nothing about insulin pens. They knew nothing about diabetes, and I had to explain a bit, what the diabetes is and what the liquid in this device is before they let me go. They were very serious people, and I was very serious in that moment as well.
Veikko, do you order special food from the airline?
Actually, I have never done that. I know that, it would be available kind of food for diabetic patients, but I have not done that. So, because the food usually is appropriate for diabetic patients as well. It may be that there are some pieces of dessert, for example, which are very sweet. So then I just skip that. But other than that, I don't have ever requested any special food.
Would you recommend exercising on a flight?
Oh yeah, that would be, of course, good to prevent thrombosis, for example. And that is, I guess, that is recommended for everybody. It is not only for diabetes patients, and that is nothing specific for diabetic patients. But it is, some exercise and also drinking water, which airlines now are offering quite a lot, would help to prevent thrombosis.
What about people using insulin pumps? What do you suggest?
Insulin pumps, in terms of adjusting insulin dose, are good, devices for those who need insulin and are traveling a lot, because adjusting insulin dose when you inject insulin requires, some thinking and maybe more frequent glucose monitoring. But with the pump, the therapy is easier because you just continue, the basal rate, and then you take an extra bolus when there is either snack or a bigger bolus when there is a bigger meal. So it is more simple to adjust the insulin dose. I would maybe recommend even pump therapy for those guys who are traveling a lot, long distance hauls.
Veikko, in general, after having travelled for so many years, do you have any recommendations on flying?
Yes, I do. I mean, I do. This is based on my personal experience. You know, in the last few years when I worked for pharma industry, I traveled more than 200,000 miles per year. So my recommendation is maybe, you know, first to be prepared in terms of having all these things with you, you know, glucose, insulins, glucometer with you. And then to pay attention, you know, to the changes in the schedule. There can also be delays in the flight, and anything can happen, as we know, for travelers. But by taking good care of these type of things, it is not difficult. You just need to do that. You need to decide that this is what I have to do. I don't have much choice, and I will do that, and things go well. So, based on my experience, I would not say that, you know, insulin-dependent diabetes can prevent or will prevent you traveling. It takes a bit more focus and more time to focus on certain things. But there, you know, there are other people. There are top athletes, for example, who have diabetes. Tennis players, ice hockey players. So it is a bit the same type of thing. They can do well with their diabetes in what they are good at. And if the person needs to fly, likes to travel, he can do well when she is aware of all these things, what needs to be done.
Thank you very much, Veikko.
You're welcome.